What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. And if you're dealing with long COVID, I really hope your symptoms start to improve soon and that we find some treatments for all these people that are suffering with long COVID. It is time now for the Saturday edition of the Pandemic Update for Saturday, August 24th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. We give you the latest news, data, new studies that come out, things about long COVID. We're going to talk about long COVID briefly today, and any other virus that could be a health threat to you. As you see here, our first story will be on West Nile virus. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. We're just going to do a shorter version of the pandemic update today. As mentioned, it may turn into our full update, I don't know. But as mentioned, we're going to talk about long COVID. That's the first thing I want to talk about. We'll get to this story in a moment. Long COVID is something I've been dealing with since on or about early 2020. Now, for the most part, over the past several months, a lot of my symptoms have greatly improved, with a couple exceptions. Asthma. Asthma is something I still deal with, and it's something that I am getting injections for, monthly injections of a drug. I believe it's called Xolair, and that it does help me, but back when we had those really hot days, it was hard for me. Something else that still pops up once in a while, and it's getting more and more rare, which is a good thing, but today is just one of those days. Notice it's after 5:30. We're very late with today's update. It's because today has just been one of those days where I just randomly lose energy, get tired. I think there's a lot of people that can relate to having this issue very early on after having COVID. Mind you, it was a suspected case of COVID. It was in the early days before testing existed that I had COVID, and then went on to develop all these new symptoms several months later, which I deemed to be long COVID. Energy loss was one of them. Well, today is just one of those days. It has come back to bite me, and hopefully by tomorrow it'll go away. Nowadays, when I get it, it does seem to go away the next day. We'll have to see. It's just been one of those days. All right, moving on. I'm sure if you can relate to that, leave a comment down below. Let me know. Are you someone that deals with long COVID energy loss from time to time? If so, let me know down below. Starting off with his first story today, Dr. Fauci is currently recovering. Yes, he was hospitalized for West Nile virus. Now, you could make a lot of different speculations down below. Um, did he have some immune system loss from his cases of COVID? I mean, I'm sure there's a lot of people out there speculating it. I've been seeing it on X, a lot of posts about that. But let's face it, West Nile virus is a real issue, becoming a real issue here in the United States. You know, all these different insect viruses. You know, an insect bites you or something, and there's viruses. With our warming climate, more and more of these type viruses are going to become a thing and popping up, and he's recovering at home. I'm hearing it sounds like his case started just from his own backyard. He dealt with it. So, yeah, and West Nile virus, here's the one takeaway about this is there is no vaccine or specific treatment. Most cases are mild. In some cases, you do get hospitalized for it. Fauci was hospitalized about 10 days ago, and now is recovering and resting at home after all of his symptoms. So yes, this is not good, and it's a significant disease for some. Some people do go on to get it relatively significantly. All right, this is something that's just totally ridiculous. This is coming from the CDC. NBC News reports on it. No plans to close schools in the event of a Mpox. I gotta say Mpox. That's what it's called now. Formerly known as monkeypox. Mpox outbreak, the CDC says. Despite misinformation, and it's been floating around. I've been seeing it. People have been saying, oh, if there's outbreak, schools are going to close. CDC says if there's an outbreak, there's no plan to shutter schools, which I think is ridiculous. I think if a school ends up, for whatever reason, ends up with a huge Mpox outbreak, Shouldn't you try to contain the virus? Just saying. Moving on now to this. No, that's from yesterday. We don't want to take a look at that. This, we want to take a look. In Cambodia, a 15-year-old girl has died from H5N1 bird flu in Cambodia. Yeah, this is not good. It's something that we continue to monitor. Going back to the first story with Dr. Fauci real quickly. I am aware of there being a virus that is spreading up in Massachusetts, and I'm hearing that a town in Massachusetts is now going to be doing a curfew because of that virus. Oh, that's getting interesting. We're going to have to keep our eyes on that. I chose not to include that into today's update. Maybe we'll include it into tomorrow's update if I learn more about the virus. Sometimes I just have to personally research on these viruses. I'm not, as you all know, I'm not a virologist. I'm not a doctor, so I don't know about every virus out there, but I have started to learn about more and more viruses as we walk through this pandemic and everything else together day by day. Taking a look at the website, not much to show you here today. I do want to note to you that I am eventually going to be catching up on the COVID positive archive. Yes, I'm going to be doing a lot of work on that while on vacation. So I'm going to be, like people who have died of COVID, you're going to see a lot of names added to that. And I will catch up on the names that I have missed as of lately. Moving on now to heat-related illnesses. They're still a problem in all regions of the United States. It's starting to improve a little bit in the northern states. Take a look at the pollen levels. Let's refresh this. 38% of the country is in medium to high status today. There's a lot of red out there. Taking a look at what's going on with air quality levels. Let's see. And we should come up with a mixed bag of yellow and oranges in a lot of places. Yeah, look at the east. Yellow galore. And you do see some oranges mixed in between as well. Taking a look at my other X account, that is Climate Data Report. Follow that for anything weather and climate. Yesterday, Philadelphia recorded 866 EMS incidents, which that is a really high number. And speaking of high numbers, let's see how many EMS incidents there are in Montgomery County, Pennsylvania right now. We're seeing a cardiac emergency twice, hemorrhaging, unconscious subject, hemorrhaging again, allergic reaction, respiratory difficulty. Not terribly busy. Hopefully, not terribly busy right now in Cheshire County. I'm seeing sick person a couple times. Yeah, busier than Montgomery County. Let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9 calls right now. That is busier than Montgomery County, Pennsylvania. Walgreens this week, the positivity rate was 37%. That was down 1.3%. Total number of tests did go up. We'll have to see if that continues next week. Canada, COVID viral activity level is high, flu is low, RSV is low. Flu B was not detected at this time. Taking a look at the epidemic status for COVID in the United States, we can see it's still increasing in several places. It's likely declining now in North Carolina, Louisiana, Texas, and in Alaska. All right, let's take a look at something that was provided us from user CSJ or CJS, Charles, we'll call, on in the comments section, and I basically did a screenshot of it today rather than copying and pasting it to a note. And there's some not good numbers in his report here. This is really bad. Florida added another 1,933 new cases yesterday, 64 new deaths in the daily update. The weekly update shows that they had a total of 13,174 new cases and 224 new deaths. That number needs to come down a ton still. New Jersey, 536 new cases and 4 new deaths reported, and their weekly total was 4,880 new cases and 10 new state-reported deaths. New York added for the week 13,286 new cases over the past 7 days. Yesterday was 2,137. 54 new deaths this week. You kind of get where we're headed here. I think it's going to be another week where the United States does go over 1,000 deaths. Virginia, 1,386 new cases added to their open data page showing cumulative numbers today, and for the week, it's 8,222 cases. Puerto Rico, 475 new cases and 10 new deaths added today, and for the week, wow, 3,158 new cases and 16 new deaths. California had a really high number. 13,512 new positive tests, including fill-in from August 10th through the 12th, and 111 new deaths. Connecticut, 203 new CDC reported hospitalizations and 11 new CDC reported deaths. That seems like a really high number for Connecticut in the summertime. Illinois had 342 new CDC reported hospitalizations, 36 more deaths. Louisiana, 2,365 new emergency department visits, including 100 from the previous 2 weeks. That number is still way too high. 15 new deaths. Mississippi, 15 new deaths. Missouri, 19 new deaths. Montana, 9 new deaths, and he says that is a big number for Montana. Oklahoma, 23 new reported CDC deaths. Pennsylvania, my state, 550 new CDC reported hospitalizations and 29 new CDC reported deaths. Texas, wow, another 8,146 new cases and 51 new state reported deaths with the CDC number. Wisconsin, 2,259 new positive tests, including over 500 previous 2 weeks. And 11 CDC reported deaths. Their positivity rate is 19%. West Virginia, 1,773 new positive tests and 10 new CDC reported deaths. Now, I'm sure there's someone getting ready to type away at the keyboard and add a comment saying, yawn, some of these states used to report those numbers daily. That used to be the daily total number of cases. Hi. This is the summer of 2024, where less people go out to get tested or bother to get tested at all. Yes, these are significant weekly numbers because, yes, we are in a summer COVID surge. Moving on, the KP 3.1.1 variant still dominates at 36.8%. Taking a look at wastewater, which we will do tomorrow. We'll do our full wastewater update tomorrow. Just a measly 13 wastewater sites in the United States are reported at very low levels at this time. That is totally atrocious. That is ridiculous. That should not even be a thing, but here we are. All right, let's close out today with taking a look at emergency department visits, and we will make one detour along the way, and that stop will be taking a look at New Jersey. So emergency department visits, they have peaked in the United States. They are starting to drop at this time, which is some really good news. Alabama, take a look at this. It's starting to drop. And again, the national level has peaked. Alabama's starting to drop. Alaska is dropping. Even Arizona is starting to drop at this time. Arkansas is starting to drop. California is dropping. Colorado is dropping. Connecticut's still rising slightly. It's going to take a little longer for the Northeast. Delaware is, looks like maybe it's starting to level off. Washington, D.C. has dropped some. We'll have to keep an eye on that. Their cases just started going up once again. Florida is dropping, thank goodness. Georgia, just bouncing off the top. Guam shows it may be rising a little bit once again. Hawaii has risen slightly. Idaho is rising slightly. Illinois is still rising. Indiana still rising, maybe leveling off soon. Iowa starting to drop some. Kansas is dropping slightly. Kentucky is now up to 4% of all emergency department visits being diagnosed with COVID. Remember, that's what this is. These are people showing up to the emergency department diagnosed with COVID. That is really bad. And Kentucky is still going up. Louisiana starting to drop at this time. The great state of Maine is starting to drop. Maryland is starting to drop. And Massachusetts bouncing off the top. Looks like it may be dropping soon. Michigan continues to rise. Mississippi is starting to drop at this time. Montana has leveled off a little bit. Nebraska, yikes, you're still rising. Nevada is dropping slightly. New Hampshire's still rising, and you're going to see in wastewater tomorrow. I'm going to show it again. New Hampshire wastewater is doing really, really bad at this time. New Jersey has leveled off. It's trying to drop slightly. Let's go over to New Jersey real quickly. And New Jersey hospitalizations are 529 today. I do believe that could be, keyword, could be a correct number. 12 people on a ventilator. Discharges 77. In the ICU 58. 70 out of 70 hospitals are said to have reported. New Mexico. It's trying to drop, but it looks like it may still be rising slightly. New York was starting to drop. Now it's leveled off a little bit. We'll have to keep our eyes on that one. North Carolina is starting to drop slightly. North Dakota is dropping slightly. And Ohio is continuing its rise at this time. Their cases rose once again this week, so it only makes sense. Oregon is dropping slightly. Pennsylvania still rising, maybe slowing slightly, I hope. Rhode Island is starting to drop slightly. South Carolina is still rising. South Dakota, yeah, it's still rising at this time. Tennessee showing signs that it's about to drop. Texas is dropping. Utah is rising slightly. And Vermont is dropping at this time. Virginia leveling off slightly. Washington is dropping slightly. West Virginia starting to show signs that maybe it's peaking and will drop soon. Wisconsin still, yeah, maybe it's going to drop soon. And Wyoming at this time has flattened out. Alrighty, folks, that does it for the Saturday edition of the Pandemic Update. We'll have our full wastewater update again tomorrow, and tomorrow will be our last update in Pennsylvania for a little while, and then I go up north. Monday, we will be doing an update from another state. I don't know what state that's going to be. It's going to be an out in the wild update. And then, of course, after that, it will be the updates from where I'm away at my relative's place up in Maine. And I got a feeling there's probably going to be a few missed days over the next week and maybe in between. Forgive me for that. Yeah, I think it's time I take a little break from these updates. Maybe that's what's getting me tired. It's just too much. But I think I probably will take a little break in between. You'll still see me popping on, and who knows? Maybe we'll hit 5,000 followers soon. We're getting really close. If you like this video, thumbs up and subscribe down below if you're new. Let's try and get to 5,000 by the time I come back from vacation. Hit that notification bell, share these videos with anyone you know, and leave a comment down below. Quick note, if I do hit 5,000 while on vacation, I do have a COVID-safe place. I plan to do some sort of a video, a special treat with a really beautiful view. I'm going to try and make something happen out of that. So, I will see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Saturday evening. Thanks for watching. Be safe. Have a great evening.